Hi, how are you? Good morning, good afternoon, good evening, wherever you are. Uh, Today, this is my seventh talk in Quarantine Positive series. Uh, so today I wish to talk about the use of the tinnitus point combination in YNSA and how these points can be very useful treating tinnitus and a very effective. So before we go into the location of the points, I wish to tinnitus, there are two types of tinnitus. There's subjective tinnitus, which actually the definition of subjective tinnitus does not involve an identified source, so cannot be heard by examination. That is subjective. That means the patient hears the tinnitus and he has this irritating sound in his ear, but when he goes to be tested, there is no the observer or the physician cannot found, or any examination, they cannot found the source and the cause of the tinnitus. So that's subjective tinnitus. The second type is objective tinnitus, where the perception of sound, which has physical source generated in or near the ear. An external observer can provide objective tinnitus. So that means basically objective tinnitus means that the patient suffers from the tinnitus, and at the same time it can be observed and identified by external observation or external testing. Not only the patient feels it, but it also has objective testing, and it has been identified and diagnosed with tinnitus. Now, tinnitus, the sounds that the patients can be hearing can be high pitch, low pitch, can be a ringing sound, can be a cricket sound, it can be this white sound from like a radio, like ocean. It can change from, in the morning could be one sound, in the evening could be a different sound. It could be changing from time to time, and also the sound in which a patient can hear. A lot of times in objective tinnitus, they know it has got to do with damage, certain disorder in the area of the brain, and the sound is coming from the brain. Another way to look at objective tinnitus is also in a manner, just like phantom pain in some manner, that there's a sound there which the brain is creating, which is not necessarily what needs to be there, but he has done neuroplasticity to fill in some gaps due to some damage to the inner ear or the nerves, and then the patient is feeling or having this sound in his ear. Right? They know that tinnitus could be caused by stress, long time stress, sleeping disorders, or problem in sleeping. Even we can feel from a day-to-day tinnitus, even if we know that one day we didn't sleep well, and we have a lot of tension, stress, and a lot of stress, or even we wake up in a bad mood that day. Sometimes with all those occurring, we can have this constant sound of tinnitus, but what will happen probably the next day, after a few hours, it will disappear. But when we're speaking about objective tinnitus due to any cause, like could be stress, emotion, depression, loud sounds, just like loud sounds, and etc., it will prolong for more than 6 months, and then does not go, and it is constantly there. Now we know that tinnitus is a very bothering disorder. It can help cause the person who is suffering from lack of sleep due to this loud sound, It could cause think that you have the contents down your ear, so it can cause also depression. So you're having depression and you're going to have this depression cause, and stress, which is actually all these trigger fire and make the tinnitus even worse and more severe. And this might be the cause, one of the causes. Now, in research, what they've been doing today, they've started to understand that there is maybe a connection between dopamine and serotonin, and by maybe these drugs or these type of drugs might reduce the tinnitus to these people that have been suffering with reducing the daily life stress, physical and emotional. So that's with the tinnitus. What I want to speak more today about of the points, how we can use certain points to treat subjective tinnitus. Now, in general, subjective tinnitus can be caused by something that could be caused by something in the jaw, in the ear, the muscles around the neck, the upper area of the back. All this tension there on the muscles can cause the tinnitus. So by treating it, we can actually get a better effect. But before that, I just want to go into a bit into the anatomy of the ear. So we have, actually the ear is divided into three different regions. We have the outer ear, okay? We have the outer ear where we have sound, which might be occurring here, or sound waves that run into the ear. They get to the tympanic membrane. The tympanic membrane receives the vibrations of the sound, okay, just like an ultrasound. The sound there causes the vibration of the tympanic membrane. Then we move into the inner ear, okay. The inner ear, we have these small little bones, okay, that start tapping like a drum, okay. Tap like a drum. This is the inner ear, and then they send their information of the tapping of the drum to the area of the mid-ear, the sopranic canals, okay? And then the sounds will be picked up by the vestibular nerve, or by the cochlear nerve, mainly by the cochlear nerve will be picked up, and then we will identify it into sound, into words, or etc. and etc. into the inner parts of the brain. So we have the outer ear, inner ear, and then outer ear, medial ear, and the inner ear. Okay, so we have that all waves and sounds. Now, that's in general what is happening. Now, I want to go speak more about muscles. When we speak about subjective tinnitus, why disorders of muscles might cause this irritable sound of tinnitus. So I'm just going to enlarge. I wish to go to the temporal mandibular joint here. Okay. So we go in here to what we can see, the temporal mandibular joint. Okay, so here's the temporal mandibular joint. This is the mandibular bone. Okay, then we have the disc, okay, that is covering the joint between the, which is the mandibular fossa. Okay, we have the zygoma bone here, and then we have the mandibular coming up. We have the mandibular fossa. We have a disc here, okay, which allows the things to slide up and forward. But what I want to speak to you more about is an inner muscle, a deep muscle, that lateral Pellingi muscle, okay, superior and inferior head. What this muscle will do, when it contracts, it actually causes our jaw to go out, okay? So by causing the jaw to go out, okay, we're going to cause a lot of tension in the area, on the dorsal area of the joint, okay? And then it's going to cause tension on the dorsal area of the joint. Now, in the dorsal area of the joint and the disc, there is what's called a pinto ligament, okay? The pinto ligament is a ligament that goes will pull up. Okay, so I'm going to go back to my drawing here. So if I would be down here approximately where the joint is, okay, so I would have, for example, what I call the pinto ligament. The pinto ligament is going to cause stress from here. Okay, so if we have it here, from here and go inwards towards the ear. Now that pinto ligament connects to the tympanic membrane, okay, tympanic membrane. So that's going to cause stress on the tympanic membrane, and that's going to cause irritation in the area of the ear. And that irritation might be translated for the patient into tinnitus, okay? So that's one cause of retraction of the mandibula, or change of the temporal mandibular joint. Now we know that the temporal mandibular joint, it's not only these two muscles, but also have the masseter, which is coming down to there, the masseter and the temporalis coming down to there and allowing me to chew. Okay, so any movement also in the facial muscles around here of the mimics might cause stress and might cause the joint to stick out a bit and cause that tension on that for pinto ligament, which will cause tension towards the membrane and give me some irritation around the ear. The next thing is the cranial nerve innervation, okay, to the specific membrane. So we have here all the cranial nerves. Okay, we have the facial nerve, okay, we have the trigeminal nerve, and we have the vagus nerve that comes from the ear going down, okay? Again, now there's these, and then we have these 4 cranial nerves also innervate and connect with the tympanic membrane, okay? The internal area of the tympanic membrane is connected to the glossopharyngeal, okay, from the internal part, okay? And the external part is connected to the facial nerve, the mandibular nerve, which is the 3rd branch of the trigeminal nerve, and the vagus nerve, okay? So we already understand if we go to the mandibular, which is innervation also of the chewing muscles, okay, of the mandibular, or even the facial, and think about that, that we have any contraction, or the muscle is innervating and causing more and more contraction of these muscles, it's going to radiate back towards the tympanic membrane, and again, cause irritation in the ear, and that irritation in the ear is going to cause a sound, might cause a sound and might cause tinnitus. Now I'm going back to all my lectures, I spoke about fascia and its connective tissue. Again, we have to understand that fascia, connective tissue, covers, it's like kind of the vessel in which the nerves travel, and also tension on that fascia or any catching on the fascia will cause the nerve to catch, and then it's going to cause that irritation towards the ear. So coming into the points which we wish to use. So again, we have, there are 4, Yamamoto has 4 major points that need to be used in the tinnitus protocol. We can have what we have here on the left, you have ear yin, ear yang, okay, it's the ear sensory yang, tinnitus 1, tinnitus 2, and the ear sensory yin. Okay, to locate them, it's actually very, very easy. These areas are on the superior borders of the temporalis muscle. Okay, and ear yang point is actually gallbladder 19 acupuncture point. So if we have my image here, okay, let me just erase so we don't have all these drawings. Okay, so to locate these 4 mandatory points are the major points that need to be used in this treatment. So the first point, like I said, is gallbladder 19, which is the ear sensory yang point, which is located here. Okay, so this is gallbladder 19. Okay, but that's one way of looking at it. Another way to locate it, if we would take our ear and divide it into thirds, Okay, we go to the lower border of the upper third, and we go to posterior to the mandibular bone, to the not the mandibular, sorry, the mastoid bone. Okay, we found ourselves located in the mastolamoid suture, which will be here. This is what we can see here as D yang point, which we see here in blue. That'll be the D on the yang aspect. Okay, then we jump backwards to the next notch and slightly up, and we'll found ourselves in another notch that will be about gallbladder 19, which is the ear yang point. So that's the ear yang point, as we can see here. The next point is actually the ear yin point. Yes. The ear yin point. Okay, if I would take my forehead and divide it into thirds, okay, take from my eyebrows, then I'll divide this into thirds. So I'll go, and here is the temporalis muscle. So I'm coming, this is the anterior, superior anterior borders of the temporalis. I will continue in the same direction on temporalis muscle. And here, if I look in a lateral view to a patient, you'll see that he has something or a person sticking out around the forehead. So it's lateral to the pupil line, and it's at the height of the lower border of the upper third of the forehead. Okay, that will be the ear yin point, which we see here. Okay. Okay, so basically, if you continue a direct line from the nasal bridge towards stomach 8, which is approximately here, you'll be crossing that area and that point. Okay, so you'll be on the forehead, and you'll be about so you're about half a centimeter lateral to the pupil line, and a direct angle from the front temporalis muscle towards the nasal bridge. And where those points will cross, that'll bring you to the ear yin point, ear sensory yin point. Now we have two extra points. First of all, we have the apex line again. I'm drawing out this apex line. As we can see here, we're going up the apex line. It goes up to, this will be due 20. The apex line, I fold my ear, this edge of the ear onto the area of the tragus, and I have this apex line. What I like to do is I take the height of the ear, change the color. So I take my ear from my earlobe to my apex, this distance, and I multiply it. So I take this distance and like taking my lobe and placing it here. Okay. So that'll be, if I multiply this distance, I'll find myself quite about here in this area here, up here. Okay. Get a stronger color. Okay, so I take this distance and I multiply it, and I found myself up here. And then I go about 2 centimeters to 2 to 3 centimeters anterior, and I look for a divot in the muscle, in the fascia actually of the temporalis. That'll be what will be called tinnitus 2. And then I go about 2 centimeters back, or actually the midway, in an angle between gallbladder 19 to this upper apex line, which will bring me to about here. Okay, will be tinnitus 1. Here you can see it looks lower because it is slightly lower than that apex line. So if this was my frontalis muscle, I would be on the borders of the frontalis muscle. So this will be T2, what we call tinnitus 2, and this will be T1. So these are the 4 major points that need to be used in the tinnitus. Now, you use it on the same ipsilateral to the side, which is causing the problem. But as you can see, this might be only a symptomatic treatment. But in general, these points are also very, very good for proprioception. If you have proprioception disorders, we not ignore it or neglect of that side. It's very, very useful. It's good for balance. It's good for any ear disorder, these 4 points. But this protocol is both for, mainly you do, first of all, you do these mandatory points, okay, which we see here. That's number 1. Number 1 stage in the treatment. Number 2 stage in the treatment is another 3 extra points, which we can use. which the first one are in the area of the tragus, anterior to the tragus. Basically, that's Sanjiao 21 and gallbladder 2 point. So that's the second stage. Now we already know that from inner here, the facial nerve and the mandibular nerve go inwards towards the ear. So you're already affecting the area of those cranial nerves. So you're going to reduce the sensitivity. So that's number 2 in the protocol. And number 3 is actually Sanjiao 17. Sanjiao 17 here is also very effective, which in tinnitus. Okay, that's the 3 main. So we have number 1, these 4 mandatory points. Number 2, these 2 extra points around the mandibula. Around the tragus. And number 3, you have Sanjiao point 17 is number 3. Okay, so you always see improving, and not improving, and etc. So those are the mandatory points. And like as I explained to you before, there's a lot of effect due to the temporal mandibular joint might be causing the reason for the faciale, for the tinnitus. And we need to reduce or take off the tension around the temporal mandibular joint or the area of the cervical spine, because also the trigeminal nerve gets sensitivity from the cervical spine. So you have a cervical innervation there. Also the frontalis muscle causes contraction of the area of the occiput area of the bone. So we also have that, and we have to reduce that. So we're going to use we're going to go into a couple more points that are not necessary in the protocol, but are very, very useful in using. But first, let's go into a video of the points, of the first of these mandatory points. So what we can see here, I'm going to the upper third of the ear. Okay, so we're going into the upper third of the ear. That's going to be the yang point. Okay, and from the yang point, we'll go posterior. Okay, another notch posterior, and we'll found ourselves into what is called the ear yang point, which is gallbladder 19, as I mentioned. Okay, the next is what we can see here in the anterior area. That's the ear yin point. Okay, the ear yin point is a connection between the nasal bridge and stomach 8. But like I said, if you take the forehead and you divide it into thirds, you go to the upper third, the lower border of the upper third, and continue at straight line, and where it would meet, if we would continue with the temporalis muscle, the fascia of the superior anterior areas of the temporalis muscle. Okay. Okay, the next, like I said, that's gallbladder 19. And then we have 2 points which are located in between, the tinnitus 1 and the tinnitus 2. The tinnitus 1 is the posterior point to the apex, and tinnitus 2 is the anterior part of the point. Okay, so now, like I said, now I go to the apex line. I take my ear, I multiply my height of my ear. First, I get to the apex line. Then I will multiply my height of the ear from the apex down to the lobe. Take that multiplication, and that will bring me to the superior borders of the temporalis muscle. And like I said, I'll go about 1 centimeter to 2 centimeters to 2.5 centimeters anteriorly, and look for a divot in the fascia there. Will be on the yin aspect, will be tinnitus 2, and posterior will be about 1 to 1.5 centimeters posterior and even a bit inferior to the upper borders of the temporalis muscle. And again, then you will look for a divot. So that's tinnitus 2, what we see here. Okay. And like I said, from that apex, we go about centimeter to centimeter and a half backwards, and even slightly inferior. And we look for a divot in the bone, actually in the fascia, because we on the borders of the temporalis fascia, and we look for a sensitivity there, and that's going to be that tinnitus. Okay, so like I mentioned, there are other points that we might have to use when we treating this tinnitus of the patient. So first of all, we want to have an effect on the temporal mandibular joint. So we have 2 points that have an effect on the temporal mandibular joint. The first point is what we call the TMJ point. The TMJ point is actually gallbladder 14 is the TMJ point. So that's about here, according to the YNSA method. This is a TMJ joint, TMJ point, but it's also, like I said, gallbladder 14. So now the right side, the left side will treat the left temporal mandibular joint. So it's very good for bruxism, any disorder of the temporal mandibular joint when you want to reduce pressure on the temporal mandibular joint. And remember what I spoke to you, that the pinto ligament that connects to the area of the disc or the posterior areas of the disc of the temporal mandibular joint connects to the membrane in the ear, and it's going to cause irritation and then cause that tinnitus. So that's point number 1. Point number 2 is A point. A point is actually a 2 centimeter vertical line that runs from 1 centimeter into the hairline to 1 centimeter below the hairline. Okay, and it's located approximately 2 centimeters lateral to the mid-sagittal line. This is A point. So the upper area of A is, again, the cervical 1 and the head. The lower part of A is cervical 7 and 8. Just so we understand that if we're speaking about it, this would be my hairline here. Okay, so this is my hairline. Like I said, 1 centimeter above, 1 centimeter below. As you can see, it's nearly in the same alignment with bladder 2 and bladder 1 line. Okay, so basically bladder 3 is the center of this line, and you look for the sensitive point. What you're going to look a lot of sensitivity on the upper area of this A point. Now, A point is very, very useful, like I said, for all the cervical spine. So, and also for the sensory organs. That's why it's also going to have effect on tinnitus. Another point which is very, very useful is what is called the oral points. Okay, the oral points are right here on the orbit cavity. Okay, around here, you're going to look for sensitivity in this region, and that point's going to also have an effect on the temporal mandibular joint. Okay, if I would take my eye here, it would be about here in these areas here, right in the upper corner, upper medial corner of the orbit cavity. Right, you can feel the nasal bridge, so it will be about there. Look for sensitivity. Now, this point in general is also very, very good for reducing tension around the shoulder. So remember when I said if you have tension on the shoulder, it's going to cause tension on the cervical spine. Tension on the cervical spine because of the mandibular, because of the facial nerve, is also going to cause that irritability maybe around the ear and cause the tinnitus. So you want to reduce that and treat that area as well. So that's those 3 extra points that I very much recommend to use when you're treating tinnitus. So again, gallbladder 14, basic A point of YNSA, oral points which are located right in the orbit cavity, the medial, superior medial area of the orbit cavity, right on the edge there, which will also reduce tension in the shoulder And there we have it, a very, very useful treatment in treating tinnitus. So with that, I'm coming to the end now. Thank you very much. If you wish to contact me, you can contact me by pnima.ac.gmail@gmail.com. This is my email address, or you can go to my website and even ask a question through my website. A lot of information is there. The website is being built newly, so we updating every now and then more and more information. So, like I said, this recording will be available as soon. Thank you very much. Hope you enjoyed it. All the best.